Good morning and welcome to the meeting. Thank you for attending. And this is the Adult Health and Social Care Policy Committee January meeting. My name is Councillor Argento and I chair this committee. The meeting today is open to public and press, and we also have some guests who are going to help us present. There is one agenda pack and one supplementary pack. There are some paper copies over this side of the room if anybody wants a copy. The meeting will be webcast, and the recording will also be available for people to view later through the Council's website. It is also possible that Sheffield Live will record and rebroadcast this meeting. Please can I request that mobile phones and other such equipment are switched off or on silent mode as to not to disturb the conduct of the meeting. There is no fire test planned for today. If there is an emergency evacuation, please take instructions from the Town Hall staff, and the assembly point is Studio Square as usual. I will now ask my colleagues to introduce themselves. There are a couple of members who are delayed, so they can introduce themselves when we start the meeting, when they speak. I will start on my left.
Thank you. Good morning. My name is Councillor Laura McLean. I'm a group spokesperson for this committee.
Good morning, Councillor Ruth Milsom. No, I'd already logged on. Again, obviously, been silenced from above. Councillor Jane Dunn.
Councillor Sue Alston, I'm here substituting for Councillor Will Sapwell.
Councillor Steve Aries.
Councillor Sophie Crosthorne, Deputy Chair of the Policy Committee.
I will ask officers to introduce themselves.
Good morning, Matt Bowser, the Director of Adult Social Care and Wellbeing, apparently slightly haunted this morning.
Good morning, Sherry Grant. I'm the Assistant Director for Legal.
I'm Fiona Martinez. I'm Principal Democratic Services Officer.
And we also have Rebecca who's helping us with the tech stuff. So we have apologies for absence. So we have Fiona, do you want to give us?
Yes, Councillor William Sapwell sends his apologies. We've got Councillor Sue Alston acting as a substitute this morning.
Okay, and item 2, exclusion of press.
Councillor Argento. Sorry, just since I spoke to you at the beginning, I've had a further message from Councillor McRooney. He now isn't going to make it. Thank you.
Can we note the apologies?
Thank you.
Yes, thank you. So item 2, exclusion of press and public. As I said previously, there are no items on the agenda that require exclusion of press and public. And item number 3 is declarations of interest. So are there any members that wish to declare an interest on any of the items that are on the agenda today? Can't see anybody, so there's none for those. And item number 4 is the minutes of the previous meeting, which are on page 11 of the printed of the pack. So I'm going to go through each page. So we got page 4. Could any members let me know if there are any kind of errors, amendments, or matters arising? So we got page 11, 12, 13. Councillor Dunn.
Yeah, thank you. On page 12 on the DAS overview, I asked a question which we received a response from yesterday, and it isn't minuted, that I asked the question regarding the impact that the new computer system had. I do have a follow-up because I'm slightly, but I'll ask it in the DAS review. But it isn't minuted and it should be. Okay, and I think the response needs to be minuted. Thank you.
Thank you, councillors. Councillor, I think we'll attach that to
Thank you.
the minutes. Page 13, 14, 15, 16, 17, and 18. Okay, so are people happy that these are a true record with the addition of the response that Councillor Jane Dunn has received? So are people okay for me to sign these minutes, but with that add? Yeah, brilliant. Thank you. So we go on to item 5, which is public petition, questions and statements. We have not received any. And likewise, item 6, members' questions. We have not received any questions on for item 6. So we move swiftly to item 7. And I think Fiona leads us on this one.
Good morning, everybody. So this is our standing work programme item. I'd like to draw members' attention to page 24 of the public pack, in which our new items and amended items are listed. Our new item there is a recommissioning of the Care at Night service. We haven't got a date attached to that yet, but it has been added to the work programme. And then we've got one amended item, which is the annual social care complaints report. We are waiting for some inclusion from the annual statement for that, so that's been moved to March's meeting from January's meeting. As ever, I remind members this is a live document, so we are able to update it as and when. If there are any items you would like to see on the agenda that aren't there currently, please let me know. And also we are starting to look ahead to the new municipal year now. We do just have that one meeting scheduled for the rest of this year in March. So we will be starting to look ahead to what items we want on the work programme for next year. Thank you.
Thanks, Fiona. So we are now on to, so are people happy with the work programme? I think there will be probably things added today already coming out of some of the items that we have on the agenda, so we can revisit that. Are members happy to approve the work programme as is? Thank you. And we move on to item 8. And I believe we have some officers and some guests coming over. Okay, so this item is on direct payments and personalisation partnership. And I will ask the officer to introduce himself and then our guests to introduce themselves.
Morning, I'm Andy Buxton, the Commissioning Officer for Direct Payments and Individual Service Funds.
I'm Faith Walton and I've got an ISF.
My name's Claire Gleeson. I work for Keyring and Keyring Help Faith to manage her individual service fund, her ISF.
I'm here today to provide an update on the delivery of Sheffield's personalisation and direct payment strategy, which was approved by this committee in 2022. The strategy sets out the Council's ambition for personalisation, describing how we will ensure people who draw on social care achieve personalised support and good outcomes through creative support planning and personal budgets. Today's report seeks committee to note the extensive positive progress made on the strategy delivery plan, to reaffirm our commitment to increase and further develop approaches and practice around personalisation, ensuring that self-directed support is the first consideration for those who draw on social care, and to note planned actions to drive further positive change and offer choice and control for people who self-direct their own support. I'll begin by outlining our current position on direct payments and highlighting some of the key achievements from the past 12 months. I'll talk through some of our priority activities for the coming year and provide an update on the development of individual service funds, or ISFs. I'm delighted to be joined by Faith, who will share her personal experience of having an ISF And I'd also like to thank Claire for joining from Keyring Support Networks, one of our ISF providers on the pilot. So currently there are 2,234 people in Sheffield who receive a direct payment. That's 1,787 adults and 447 children and young people. 28.43% of adults drawing on long-term support do so through a direct payment, and that places Sheffield just above the Yorkshire and Humber regional average of 28.1% and above the England average of 24.5%. Employing personal assistants continues to be the most common use of direct payments, with over 1,312 people acting as employers. Other common uses include activities outside the home, home support, transport and supported living arrangements. Over the past year, we have seen a net reduction of 58 direct payments overall. This reflects a combination of factors, including improved council-arranged provision, people choosing alternative forms of support, and transitions into residential care. Our focus for 25-26 is on increasing and sustaining uptake, ensuring that direct payments are considered first wherever appropriate. Significant progress has also been made on strengthening the personal assistant workforce. So the Sheffield PA Register has recorded more than 206,000 visits, and we've had 1,783 successful introductions between employers and PAs. We continue to see more PAs seeking work than employers advertising on the register, and our online PA Workforce Summit in November attracted almost 100 delegates and broadened engagement across the sector. Looking ahead, our priorities focus on embedding and scaling on what we know works well, and central to this is embedding a self-directed first approach across the workforce so that direct payments and individual service funds are consistently considered as a starting point for support planning. During 25-26, we're looking to explore new approaches with first contact teams to ensure that direct payment budgets are set up accurately from the outset. This will help us to reduce delays, minimise the need for later amendments, and improve overall value for money. Our individual service fund development pilot has made strong progress over the past year, and I'm pleased to report that 10 people are now receiving an ISF. We're currently reviewing learning from the pilot, including the impact this has had and the difference it's made on people's lives. Some of this learning has already been shared on a national level, including a presentation to Parliament in partnership with the Equald research team. This year, we plan to fully develop and procure a standalone individual service fund framework, expanding ISF so that anyone in Sheffield who needs or wants one can access this option. This will include market development work with interested providers and raising awareness of ISFs and sharing case studies with our social care teams across adult care and wellbeing. Whilst data and performance information is important, the true impact of personalisation is best understood through people's lived experience. And with that in mind, I'd now like to invite members to ask Faith about her experience of ISFs. I'm also happy to answer any other questions that members may wish to ask.
Okay. Before we ask questions generally about the report, we've got some questions that we're going to ask Faith, and she's very kindly going to answer for us to share her experience with us. So I'm going to start, Faith, and I'm going to ask you the first question. Could you tell people what your support was like before you got an individual service fund or ISF?
Before I had an ISF, my support was worked out in hours. I had 15 hours a week at set times on set days. I didn't have much say in how or when I got support, and that didn't feel very nice. I had to wait for staff to come, which made me anxious. When I got cancer, I had to try and fit my health appointments around the days I had support staff could come to some appointments, but I had to go to some appointments on my own.
Thank you. I think Councillor Crosthorne is going to ask the next question.
Thank you, Chair. And thank you, Faith, for being here to help us bring this to life. It's really helpful to us as councillors when it comes to making decisions about things that affect people like you. You've told us a bit about your support before you had an ISF. Can you tell us a bit about what your support is like now you've got one, an individual service fund?
It's brilliant. I have had my ISF for eight months and my life is so much better. I have more choice and control. I use a path plan to work out my goals and how I wanted to achieve them. I talk about my hopes and what matters to me. We worked out a plan together in a way I could understand. It wasn't professionals telling me what I should do. It was about what I wanted for my life. I can see the steps I need to take and who can help me. I feel in control now. We looked at three things in the community and talked about how not everything needs to be paid support. My support is more flexible now. I still have some time, like a shopping day, but if something comes up, I can change my plan by ringing my worker. We also meet in the local area, so I don't have to stay at home waiting for staff. My ISF has helped me get my home sorted. I wanted a home that I felt proud of. Before my ISF, it was a nightmare. I tried decluttering with my worker. We got so far and then I brought things and cluttered it again. We never got time to finish it all because something else came up. Doing the plan for my ISL helped me realise that I needed more specialist support. I used my ISF to pay for the clutter doctor. They helped me get organised. I have also started art therapy, which is free. I'm working on a mood board. It helps me keep on top of things. It has helped me understand that when I get ill, I let things slide. Now I understand that my cluttering stems from living in a mental institution, as when I lived there, they took away all my possessions. I'm also using my asset for things like gym. I don't want a support worker with me at the gym, so I am looking at getting a personal trainer to help me get into a routine. I want to share the cost with someone else. What as an ISF on an ISF so we can make the most of our money? We can support each other. Once I get into a routine, I won't need the personal trainer anymore. I also use my ISF to pay for a carry base. This is a piece of equipment. It's like a planner and it reminds me to do things. Staff used to remind me to have a shower. The carry base reminds me now. It helps me get into a new routine and feel more independent.
Amazing. Thank you, Faith. Councillor McLean.
No, it's great, Faith. Thank you for that. It was really good to hear about how things have got better with your ISF. So my question to you is, could you tell us what the best things are about having an ISF?
The best things about an ISF is that I'm in control. Before my ISF, I never knew how much my support cost. With my ISF, I know how much money I have. £364.59p. Now where did I get to? So, and money I have to spend each week, and I decided how to spend it. I don't have to spend it all every week either. ISFs are really flexible and work around my life and what I want. I get to choose what's important to me as long as it's linked to my care and support assessment. I use some of my ISF for things that aren't planned, like if my health gets worse again and I need help to go to appointments. This means I don't need to keep going back to a social worker asking to make changes. I can save up some of my ISF for things I want to do in the future, like support to go on holiday. I get a financial statement so I can keep a track on what I have spent my money on and how much money I have left to spend. This helps me to plan for the future. I have become more independent since my ISF. I am more confident, and I think this is because I am in control. Having an ISF helps me to live a better life. I think more people should be offered the chance to have an ISF.
Thank you. Thank you. I think, thank you. I know how nervous you were about coming to this, room that looks really grand and intimidating, but you have, as I said before, this makes a huge difference to us because we can really understand how decisions that we make in this room affect real people like yourself. And you couldn't have said it better, so thank you so much. So I am going to ask, so you're done, but you stay there, and I'm just going to ask members whether they have any questions in terms of the report itself, and if they want to ask any questions on the report. Councillor Mills.
Andy, can I just ask, so Faith has said she wishes more people could be offered an ISF. How does the offer work? So if someone's coming, if someone's already in receipt of social care, how would they transition to an ISF? Who makes the offer, or do they need to find out about it and ask?
Yeah, so at the moment we're in a development pilot. So we are, we initially started by working with 3 interested providers, of which Keyring is one of those, on working with us to test out ISFs and how they work, and that is based on our supported living contracted framework. Initially with the pilot, we spoke with people who we felt could be more flexible, do more, try something different with how their support is being delivered on the traditional council arranged service model. And so we've used that to make that offer to transition us into ISFs. We weren't necessarily expecting to, but this year we've also had people who are brand new to social care, who have come in at the very, very start, and actually they are not able to have a direct payment for various reasons. It's not something that we can set up for them. but they want personalised support. They want a lot of flexibility. So traditional council arranged services would not be appropriate. So it's been really positive that we've been able to offer ISFs as part of the pilot for those people as well. So although the pilot is small at the moment, as mentioned in our report, our plan is to develop a standalone framework so that it's not just for people who would normally go through our supported living contractual arrangements. It would be open to anyone of all age or ability to be able to have an ISF if they wanted to.
Thank you. Councillor Alston.
Thank you. Firstly, thank you very much, Faith, for that. That was inspiring, I have to say. Just a question on the report, if I may, which is just about the, in the section on the report we talk about the personal assistant workforce. The last line is the demand for PAs remains urgent. I just wondered how and where we recruit people from, and just because I'm obviously new to this and I'm not clear, who is responsible for ensuring that they are appropriately trained and then matching them with the person they will be providing support with to make sure that that match is appropriate?
Yeah, so over the past 3 years we've done a lot of work around developing and trying to grow the personal assistant workforce. We've heard a lot from people who use direct payments and who self-direct their support, who commonly tell us that it's difficult for them to recruit the right staff for them and to be able to find them. So one thing that we've done over the past 2 years is we have contracted with Disability Sheffield to develop, well, they co-produced a Sheffield PA register, which acts as a website where people who are advertising for PAs can post those adverts in one place. But also people who are interested in becoming a personal assistant are able to create a profile with their skills and expertise and say when they're available to work to try and encourage those connections. So that tends to be like the first port of call that people receive support to do that. But people use a variety of different methods, so whether they go through university job shops, whether they advertise through word of mouth, people that they know. Sometimes it's people who they know through a school community, if it's for children and young people. So there is a variety. In terms of making sure that people have got the right skills and expertise, our direct payment support service supports direct payment recipients who wish to become employers, to support them to think about the skills, attributes and the experience that they need their staff to have, and so that can be incorporated into job descriptions, person specifications and adverts. And also we support PAs and individual employers to access training and development, so there is funds available through Skills for Care that individual employers can tap into to be able to train their staff accordingly. And we provide that ongoing support through the direct payment support service if there's any concerns or issues that might arise.
I'm going to take Councillor Crosthorne and then I'm going to bring this to a close. Is that okay? Thank you.
Thank you, Chair. And again, thank you, Faith. It was a lovely and very clear information that you've given us, so thank you. I've been contacted by a couple of people who work as PAs at the moment, but are here on, say, for example, sponsorship visas or charity worker sponsorship visas, that are now having issues with those visas and are really confused as to where to go. And certainly as the demand for PAs in the report, as it says, remains urgent, and through the work that I do outside of the council with people with disabilities, I see how these people work, and they're fantastic. You know, they're an absolute credit to the city supporting our loved ones, and they work really hard and do an incredibly good job, and I'm concerned that we're going to lose some very hard-working people. When we already are struggling with the demand for PAs, to issues like that, how do we support people in the workforce that are struggling with that? Is there an easy place to direct them to? Because I'd be really concerned if we lost people like that are working really hard.
Yeah, that is a real concern, and it's quite a difficult process and environment for individual employers to to navigate and get through. We do have a dedicated workforce development team within the council, and there are officers around where their area of responsibility is around supporting the sponsorship of overseas workers. I'm not sure on the specifics, but we can put you in contact with that team to work through that.
Thank you.
Thank you. And thank you again to Faith and Claire and Andy. I just wanted to say thank you for all the work. In the report, it's really clear the arch in terms of where we come. I'm thinking about 3 years ago when we were talking about developing the PA register and where we are now. I think it's really, there's been a lot of work in there, and it's incredible. So thank you for that. So excuse me. The recommendations for this report are on page 32. Excuse me. So the recommendations are: the Adult Health and Social Care Policy Committee is recommended to 1. Note the positive progress made on personalisation and direct payment strategy delivery plan. 2. Reaffirm our commitment to increase and further develop approaches and practice around personalisation, ensuring self-directed support is the first consideration for those who draw on social care support. And note planned actions to drive further positive change and offer choice and control for people to self-direct their own support. Are members happy to approve those recommendations? Thank you. So we move on to item 9 on the agenda. Yeah.
Can I just make a comment while they're just getting set up? Interested in response to the question about people whose sponsorship or visas are coming to an end. There is a Yorkshire and Humber organisation for that, isn't there, that people can be referred to? I think it's the Yorkshire and Humber International Recruitment Project.
I think the council supports with that via that project.
But there
anyway.
is specifically an organisation that deals with that. So I'll send you the email address if you can't find it.
Good morning. My name is Catherine Bunton. I'm the Director for Quality, Strategy and Partnerships. I'm stepping in for Mary Gardner today, who couldn't be here, and I'll let Lee introduce himself in a second. He's just getting set up with his computer. But we're here this morning to provide an update on the Carers Delivery Plan, the contract novation from Sheffield Carers Centre to Crossroads Care, and our commissioning intentions for 2027. The recommendations in the report centre around reaffirming our commitment to people who are unpaid carers, noting the progress made on the Carers Delivery Plan, noting the novation of the contract, and approving the commissioning of Sheffield Carers support going forward, noting that the final specification and model will be informed by feedback from unpaid carers, the outcome and recommendations of our CQC assessment, and best practice and evidence. Attached to the report is the Carers Delivery Plan, and in brief, that plan is how we make our carers strategy vision a reality. Its actions are underpinned by the principles in the strategy, and they are all about driving a positive change for unpaid carers in the city. We take a multi-agency approach in that, with a range of partners contributing to the plan. A couple of examples of the real difference that our work has made to unpaid carers are improving our adult social care outcome framework scores, which was a key priority in action for us, and evidence from the survey of adult carers in England from just over 500 responses shows a positive movement in 4 out of 5 of our carer metrics. We're really happy to report that the Ascroft measure around carer reported quality of life has risen from 7.4 to 7.7, outperforming our regional and national benchmarks and signalling that improvement. Secondly, we've launched a new young carers needs assessment developed in line with no wrong doors for young carers, and that's considered best practice by CQC. Together we got this done, working collaboratively across adult care and wellbeing, children's services, the ICB, Sheffield Young Carers and Sheffield Carers Centre to design that process and assessment form. most importantly, young carers themselves shape the work. Looking ahead, we've got 2 key areas to focus on in the next 12 months. That's the co-production of our new carer support service specification, which Lee will talk a little bit more about, and secondly, enhancing our digital offer for carers using our accelerated reform fund to develop a carers app, which will help use AI to help carers navigate information, get what's relevant for them and the person that they care for, which we are aiming to launch in summer this year. Lee.
I think I've got a screen reader malfunction.
Oh, right, okay.
No,
Just give us a second.
what's it saying? Is it?
That's the home page.
Okay. It's not reading anything.
No, that's Teams. What does it look like?
Apologies, we just have some technical.
What I'm going to say. So, are we on the microphone?
Yeah, that's on.
So, hello everybody. I'm Lee Teasdale Smith, Commissioning Officer, and my main focus is on support services for unpaid carers. So, I was going to talk about a couple of things. The first thing was the novation of the contract from Sheffield Care Centre to Crossroads Care. I think the first thing to say was that everybody was really focused on making sure that unpaid carers were central to our thinking, so that there was continuity of care there for carers, and to make sure that the service was still available for them and without any disruption. And on the carers register currently, there's 11,611 carers, so it's a vast number of people. So we really prioritised making sure that there was still a functional service when things moved on the 2nd of January this year. We think things have gone smoothly so far. Feedback has been really positive, and Crossroads Care are making great strides, and they're a provider, I think, that we vetted and that we've got a lot of trust in, and they do have some provision at the moment that falls under the remit of CQC, and they're currently rated as outstanding. So there's potentially a lot of good things that will happen in the next year, hopefully. So that was the first thing that I was going to cover. The second thing that I was going to talk about was commissioning intentions. So really just to say that we've got a year left of the existing service. So the 1st of January 2027, we need to have a new service in place to support carers. I think it's something that's vital. I think it's something that we really need, and carers are an essential part of what we do in terms of health and social care. So it's thinking about the future. We're starting to plan now. We're doing that with carers. So carers are very central in terms of working through what the next iteration of the support service looks like, and we want to shape that service with carers so that we come up with the best possible solution for them, and also input things like or consider things like what CQC say, benchmark against other areas, look around at other specifications, things that are happening elsewhere, look at best practice and things that we can integrate. But as Catherine mentioned, I think there's been a lot of progress that you can see, especially going back 10 years, in terms of what's happened with our ASCO scores and carer reported quality of life in particular, where we used to be bottom of the region in a lot of the metrics, and now with carer quality reported of life, we are potentially very near the top once the provisional scores have been finalised, and we can look at other areas. So that there has been progress, and we want to continue that. So I think, to summarise, I think 2025 has been a difficult year for partners that we work with on the delivery plan. So obviously everybody knows about what's happened with the ICB and with the Carer Centre as well. It has been a very difficult year, but there have still been a lot of positives and a lot of highlights. And so I think that's the focus, continuous improvement. There are some good things happening. There are some things we can improve. Let's keep focusing on what we need to do next to make things better for unpaid carers, so that they remain at the heart of what we're doing. Because it's important for both health and social care systems that we get it right, because if they're not there providing that unpaid care, then the service will have to step in and potentially do that, and then that comes with a cost, a social cost as well, in terms of, you know, that the best outcome for us is the unpaid carer continuing to care, rather than services stepping in to do that. So economically it makes sense, and socially it makes sense. So yeah, I think that was everything. Apologies with the screen reader. So, but yeah, I think that's loosely what I was going to cover. So happy to take any questions.
Thank you. Thanks, Lee. I have Councillor Ayres.
Yes. I'm looking at the spreadsheet where it talks about new referrals to the Sheffield Carer Centre, and the column that says inquiries about coding in GP practice have shown that carers are not being routinely identified and coded on GP systems. The ITB are looking at incorporating coding in GP practice in the quality contract. This is something, I think it was a question that Councillor Alston was going to raise, that we've been talking about identifying hidden carers for decades now, and we seem to be making very, very slow progress over time. I'm just wondering what further we can do as a council in order to, you know, it may be one for health scrutiny, Councillor McLean. You know, we're talking about working with general practice to see what general practice may be able to do. But I'm just wondering what your response might be on that, what we can do as a council to, you know, it is a you know, we as a council we have considered it as a priority. Yeah. Identifying hidden carers. Yeah. Council also may want to come in on this herself, but over many years, what else can we do?
Yeah, I think it's a really important question, and we know that 70% of carers are flowing through health services either with the person they care for or in their own right. In terms of slow progress, I think to a certain degree it is very tricky, because the nature of the caring population, it's not static. So around 20,000 people start caring and 20,000 people stop caring each year in Sheffield. So there's always going to be a requirement to identify more new carers, more people that are new to a caring role. And I think it's also the fact that we've got the budget we've got as well, which you know is difficult in terms of wanting to support everybody that we can. But I think prevention, getting to people sooner. There's obviously a legal duty around that anyway, in terms of prevent, reduce, delay that applies to carers in Section 2. But I think getting to people earlier, making sure that we've got the information, doing things like we're doing in terms of the looking at the app, and how we can support carers to get to information better, which is coming out in the summer. So yeah, getting to people sooner, getting them good information sooner, so that they don't end up in crisis, and yeah, working with health to identify more people at source. So because you know NHS England says it takes an average somebody 2 years to recognise that they're a carer. So yeah, there's still work to be done with health partners, but I think that's why the delivery plan is so important, because it does take that partnership approach. So yeah, I think it is trying to build on the relationships are there and enhance what's there as best we can. with the financial envelope that we have.
Thank you. I'm going to bring in Councillor McLean.
Thank you. And just to respond to Councillor Eris's point about the role of health scrutiny, tomorrow at our scrutiny committee we've got the primary care update. So if we did have questions about carers and how that's been handled by general practice, we could ask those then in the morning.
Thank you. It's possibly in the report, but I am struggling slightly with all the tiny text in the grid, I have to confess. And I know I can use Control F to search it, but I don't know what I'm looking for. So forgive me if it's there in plain sight. But when we're looking at kind of finding every avenue through which carers can be identified and signposted, are we confident that every care professional who's working with people in their homes feels that they are mandated to do that job, to identify, you know, because a care professional goes in for a few hours a week, but the other hours maybe a spouse is looking after the person as well, and so they're the unpaid carer. Are they all identified? Do we know that that works robustly, or is our care professional workforce all fully kind of, what's the word, empowered to do that?
I would say that there is a lot of messaging around, you know, the importance of identifying carers. I think, as with health, you know, there's messaging from the council. There's also messaging from health services, but I think you'll always find pockets of practice where it may not be ideal. And we put on the Carer Centre and Sheffield Young Carers run some joint training 3 times a year, and the Sheffield Carer Centre also did 22 separate training sessions for professionals because of that exact point, that we need to be sure that people know to ask, you know, the right questions and to ask people if they need linking to support, and to be told what is available for them. As I mentioned, it takes somebody 2 years to recognise that they are an unpaid carer, and people don't always identify with the label. They think of themselves as a son or a daughter, you know, a brother or a sister. So, and some people actually find the term carer alienating. They don't like it. So I think it is about having considered conversations, making sure that people know what to do. And yeah, we do try and tackle that, but I think, yeah, you are going to get some professionals where what they're saying, what they're doing isn't ideal.
Thank you. I'm going to get Matt to come in now, and then I'm going to bring it to a close.
Thank you, Chair. So I think just a couple of points to add. First, in response to Councillor Aris's query, there's an organisation called Mobilise that's adopting different ways of reaching carers to the traditional routes that have shown some positive impact elsewhere in the country. So I think there's something we can learn from that to try and build our reach further. And I think that's particularly important because the number one thing that carers say once in the system is, if only I'd known sooner about the range of support available, whether it be respite, welfare benefits, advice, or just simply the ability to be with other carers and have peer support. Secondly, I met with Rotherham Crossroads yesterday. I think they've done a brilliant job picking that service up. Starting anything on the 2nd of January is not easy. I'm sure all of us will remember what we felt like on the 2nd of January. Not perhaps at our fighting fittest, but they've done a great job. They've got the ball rolling quickly. They actually have a CQC outstanding rating for the service that they offer in Rotherham, and they've adopted a number of different routes to supporting carers in non-traditional means. So there's something to learn there. And finally, just to remind committee that the Sheffield Care Collaborative, formerly referred to as the Partnership Group, has carers and informal carers as a key work stream. That meeting took place yesterday morning. There's a number of interesting projects that are coming out of the ground across the system that will further help and strengthen the offer to carers. So I welcome the update that's been provided here by Lee, and I think given that you didn't have access to your notes, you've done an exceptional job in narrating that as clearly as you did. There's no way I could retain that level of data. But I think there are those 3 additional routes on top of what we traditionally have done to try and reach further. Thank you, Chair.
Thank you. Just going to go to the recommendations that are on page 64 of the pack. There are 4 recommendations for this report. Number 1, reaffirm our commitment to people who are unpaid carers across the city so they feel recognised, valued and supported. Note the progress made on the carer strategy delivery plan. Number 3, note the innovation of the Sheffield Carer Support Service to Rotherham Crossroads. And number 4, approve the commissioning of Sheffield Carer Support, noting that the final specification of the model will be informed by feedback from unpaid carers, the outcome of recommendation of our CQC assessment, and best practice and evidence. Are members happy to approve those recommendations? Thank you. So we move now on to item 10 on the agenda, which is our CQC progress update. And I believe that Matt is leading on this one.
Thank you, Chair. This is quite the chunky item, this one. As you'll see from the papers, there's no shortage of details in your pack. So what I'm going to do is divide the way that I present this into thirds. So firstly, I'm going to go through what the report says and pause there and give members an opportunity to ask any questions about the report itself. Secondly, I'm going to come on to the improvement approach and describe what we're going to do about it, and I will pause there again for questions in relation to the planned approach to improvement. Thirdly, I'm going to touch on oversight at this committee in the future, and clearly that goes beyond this municipal year into next year, and just ask members to have a think about the areas that you want to focus on in this committee to make sure that we can start planning that as early as possible, get the content right and get the phasing of it right as well. So it is an exercise in thirds, and the good news is that means a third of the way through I stop talking and you get the opportunity to ask questions. So in terms of what the report itself had to say, it's been out in the public domain since Wednesday last week. The headline judgment is requires improvement with a score of 56%. That places us towards the top end of requires improvement, but clearly not where we hoped to be. None of the quality statements were rated as inadequate, and 2 of the areas that were assessed were rated good: equity of experience and outcomes, and learning, improvement and innovation. The key areas requiring improvement, and I am top and tailing this report today. There is a full member briefing taking place today online at 1:15 p.m. And for those of you unable to attend, this has gone out to all members of the council. There will be a follow-up session on the 2nd of February where we will also get into the detail and create the space for challenge and questions. So the requiring improvement headlines are delays in assessments and primarily reviews, and inconsistency in the continuity of care provided. At times our systems have proven overcomplicated and not necessarily reflected the needs of people that we support. Secondly, the need for clearer improvement plans leading to better waiting time performance. And if you go through all the papers for committee over the course of the last 2 years, there's absolutely no shortage of strategies, there's no shortage of performance detail, but what the inspector have said very clearly is we need a singular plan with clear timescales, coordinated and focused action on that plan. And if that plan is working, when we are re-inspected, which is likely to be in about 2 years' time, then the way that all staff in the organisation, our partners, people whose care and support, describe the impact of that plan would be consistent and would be a bit simpler. Safeguarding has made significant progress, but there is still work to be done in terms of prioritisation and timescales for Section 42 inquiries, though progress noted. There are gaps in Sheffield in supported living capacity, particularly complex learning disability and autism, mental health support, short breaks, and younger adults with specialist needs that require more local capacity. And the inspectorate noted that there is a high proportion of people who go out of area to access that support. So there's work to do with our local market to get that right. And improvements needed in communication, feedback loops, information, advice and guidance. I arrived midway through this progress, and the ability to tell our story was perhaps more complicated than it should have been. We had lots of different versions of the truth, lots of positive stuff everybody wanted to pack in, but it could be clearer, it could be simpler, it could be more accessible. And if that's my reflection as a professional, I'm sure the system is at times complicated for people who are accessing it. So those are the headline improvement areas. In terms of the areas of strength, I want to be clear that despite the outcome, everything we do now builds on the improvement that's been delivered over the course of the last 2 to 3 years. And there are some areas of the report that the Council's got every right to feel proud about and confident about capability to improve in the future. So, the inspection team saw evidence of strong person-centred practice with a clear commitment to independence, use of direct payments, and you've just heard a really good example of how that approach has changed somebody's life, and they saw evidence of that happening at scale, and our performance on direct payments is one of the best in the region and benchmarks well across the country. They also supported our future plans to further strengthen direct payments and individual service funds. Secondly, and perhaps the area that gives me greatest cause for hope, they experience passion and dedication across the workforce at all levels, including honesty, self-awareness about what needs improvement, but a very strong commitment to getting it right and a very strong commitment to supporting the people of Sheffield. With that, anything is possible. That is the culture upon which we will build further improvement. Everybody who was part of that inspection process, whether it was the self-assessment, whether it was the presentation, whether it was the on-site element of the process, or the factual accuracy work that happened afterwards, everybody put their heart and soul in, and they demonstrated why social care matters in this city, and that is something to be hugely proud of. I think everybody came away feeling that they'd given as good account as they could in the circumstances, and I do want to record my thanks to everybody, not just our staff, the members of this committee who participated, partners, care providers, the voluntary sector, people who use care and support, and carers, all of whom had their say and all of whom came together to give as best an account of Sheffield as we could. The CQC noted strong governance and an improving use of performance data to drive decision making, including the oversight and work of this committee. That was specifically commented upon in the body of the report. Positive feedback on partnership working, cultural awareness and some innovative practices, including the work that's taken place on hospital discharge and assistive technology, more of which from Kelly in due course. Clear progress in workforce development, technology-enabled support, co-production and community-based care. So those were the major improvement priorities and the major strengths. In terms of the methodology, just a reminder, the assessment covered 9 quality statements with 4 themes: working with people, providing support, ensuring safety and leadership. The evidence included case tracking, so there was a sample of individual files that the inspectorate looked at. The financial context of the council is explicitly not part of the assessment and not reflected in the findings of the report. So that leaves us overall, as the curtains close on this part of the presentation, mid-range nationally, slightly above the regional average, and the fundamental conclusion was that the improvement journey had in fact already commenced by the time the inspectorate was on site. Our first transformation board met yesterday to make sure that that work is having impact. But I'll pause at this stage to take any question from members about the findings of the report before moving on to what we do about it. Thank you, Chair.
Thank you. Thanks, Matt, for the very clear delivery of that. And before I move on to the question, I wanted to add my thanks to all staff, partners, carers and service users who contributed to preparing for the inspection and during the days that CQC were here, and particular thanks to our staff for their passion and commitment that has been recognised in the report itself. And I'm sure that the committee will join me in the thanks. Are there any questions on the actual content of the report itself for Mark? Yeah.
Thank you. Thanks, Matt. My question is, I guess I'm imagining like a Sheffield resident who maybe at the moment, they and their family, they've not got any interaction with social care at the moment, but then they may do in the future. And they've heard the sort of headline report in the news that we've got this requires improvement, and they might be a bit worried about what that might mean. And so I guess my question is, what would you say to people who, who might have that concern? Thank you.
I think that's a very fair question. So what I would say is, if you look at the proportionate number of people that we serve, we are towards the high end. So if you need care and support in Sheffield, you will receive it. You will get through the process. You will be allocated support. Our delays in relation to assessment are not the major challenge that we face. The challenge is more to do with making sure that annually we review the needs of people once they're in the system. So I wouldn't want anybody out there to be concerned that they're not going to be able to get the support they need when they need it. I think some of the media headlines focused on access, when I think review was probably more of a headline in the report. Secondly, what I would say is that we are not challenging the finding of the report, we are accepting it, and we are going to move as quickly as possible into driving improvement. And that is a process that we need to work alongside the people of Sheffield to get right. One of the key features of that report was that we do have a series of partnership boards and discussions with people using care and support, but they couldn't always see how their feedback was reflected in what we do. We need to get better at that, and we need to be held to account for that, both here and by the public, and I'm committed to do that. The third thing I would say is that if members of the public were to speak to the significant majority of staff in the directorate, they would get a very clear sense of determination really quickly. There is no lack of grip, there is no lack of passion, there is no lack of care here. There was no finding in the report that suggested this wasn't a caring city and indeed a caring service. So overall, I would say, come and talk to us. Let us identify what we need to do to support you, and we will work with you. There's no need for panic or alarm here, but there clearly are things we need to do about the way we operate that could be simpler than they currently are. And making things simple in Sheffield needs to be a focused activity as opposed to something that happens naturally in my experience.
That's great, thank you.
Are there any other questions on the body of the report? Matt, do you want to move on to the improvement plan? Thank you.
Of course, thank you. Okay, so the headline here is we will have one coordinated improvement plan. In the appendices to the report you've had today, you can see what the headings for that improvement plan already look like. The reason why you don't have a fully fledged, signed off improvement plan for scrutiny today is we need to take the time now to work in detail with staffing groups, with the community, with our partners, to consult on how we get that done, how we achieve those priorities, how we marshal our resources, and we align the work we're doing on transformation into one place to get it to work. So I've shown you what the shape of it will look like in terms of headlines. I think if I was sitting here right now with a list of individual actions and names and deadlines, it would be preemptive. We need to do the work to get that right. There needs to be clarity, ownership and visibility about what we're doing. And I'm hoping by the end of March or by early April, we will have the meat on the bones of that plan. The Regional Care and Health Improvement Advisor, who acts as an interface between councils and government, has already been given a copy of the headlines in this report, and I've had a couple of hours long meeting with Richard to talk about our governance, our transformation approach, the things that have happened since the inspection to get out of the blocks quickly. And he will now provide assurance to government that the findings have been taken seriously and will drive future change. The improvement plan will of course align with the strategy Living the Life You Want to Live, the transformation work we've debated in some detail in this committee that is now underway, our governance framework and the performance cycle. And just as a reminder, we have the first transformation working group on the 11th of February at 12 p.m. There will be representation from all three political groups. The purpose of that session is to make sure that the data you need from that work is in the right format to come to this committee. So thank you to members who stepped forward to participate. We will look forward to that meeting in a couple of weeks. So, just to go through the headline improvement areas that I described earlier, we need a very clear and specific plan to reduce assessment and review delays. We've already tabled the review strategy here, so we've started to describe how that's going to work in practice, but there's more work to do to think about our processes and our pathways and look for opportunities to streamline and make them clearer. We need to improve continuity of care, and that includes having better handover processes where people move from between different teams to get their support right. We need to strengthen involvement, so there's no shortage of meetings that take place, but at the Sheffield Collaborative yesterday, there was a very important conversation about co-production, and in the strongest rated authorities in the region, where co-production takes place, there is clear feedback given to those networks about what has happened as a consequence, and that's the bit that's missing here at the moment, is the so what. And there is a sense in some of those networks of frustration that people spend their time, they commit, they put their energy in, but they can't necessarily see what's happened as a consequence. And sometimes that's because those improvements haven't happened, but more of the time it's actually because we haven't described them properly and we haven't communicated effectively, so we need to put that right. We need to expand our community-based options. So you've looked at things like the market position statement here that describes what we'll be doing in the future about commissioning. We've done lots of work on provider engagement, but now we need to move fast to get that capacity in the city and make sure that we've got the range of choice that we need. Some of that, by the way, has already been done and done to great effect, like domiciliary care, where we do now have the capacity that we didn't have this time 2 years ago. So we know we can do it, but we need to do it at scale. Refresh and enhance safeguarding practice, which will be about ensuring consistent, quality and timely action, and that work will be overseen by the Safeguarding Adults Board in the city, and the independent chair will be coming here next time round to talk through the annual report, the work and our priorities moving forwards. Improve communication, information and advice, which means simplifying access routes, adopting plain language approaches, but it also means that we are more confident that when we give people information, they receive it in a format that is meaningful, intelligible and clear and tailored to the right audience. So we've got more to do to make sure that that standard is met at scale. Continue workforce investment. We had some really positive feedback about work we've done on workforce development. So we've got to build on the work we've done on supervision, leadership development, and making sure that technology is hardwired into what we do wherever possible. Embed equity. So we've already started the work on collecting equalities data. We've signed up to the Workforce Race Equality Standard that committee's been cited on. We now need to make sure that the action plan that's already been produced works and drives a difference. And this afternoon I'll be off to the Equalities Group to get feedback from staff about where that's working and where it isn't. And then finally, we need to maintain transparency. So this committee should be cited on risk, it should be cited on what's working, but you should also be clear at any point in time what isn't working and what we're doing about it. There was very positive feedback about use of performance data at committee and the breadth of material that have been focused on, and it's my responsibility to make sure we don't lose sight of that. We do deal with the difficult things and all sides of the political floor, understand exactly where we are, what the priorities are, and where things aren't happening quick enough, what we're going to do to put that right. And I'll touch on that again when we go back to the performance data in the DAS update. So that's the emerging plan, some of the headlines and some of the approach, and I'll pause at this stage to take questions about improvement.
Are there any questions? Before taking Councillor Milson question, I just wanted to just say, you know, when you were talking about the feedback loop and how we, you know, we do the co-production, we have so many amazing partners and, you know, carers that contribute a lot. But this happens in other parts of the council as well, and that is the kind of, I work in the voluntary sector, and that is the kind of feedback that you're likely to give, because when we talk to people, we don't tell them what happens with what we do with the information that are provided. So that is something that I know is being addressed at corporate level as well in general, as how to improve that kind of feedback loop. So it's, you know, it's good that we are going to focus on that as well as everything else. Councillor Milson.
Thank you, Matt, for explaining all those points. In the areas for improvement identified by CQC, so I keep turning around, then my microphone isn't in the right place. There we go. So there are a few bits in the areas for improvement that look really expensive to me. So reducing delays in assessments and reviews, reducing waiting times, expanding supported living, mental health support, short breaks provision. I know these are things that are all already in the, you know, the work programme for the directorate to improve all those things already. But has the CQC feedback changed the urgency of those work streams, and has it changed how we need to be thinking about budgeting and the demand on cost as we go on?
Thank you. So the CQC's changed the way that I think about improvement on the basis that I think in the past there's sometimes a feeling that if we've got a strategy, everything is okay. If you look at the total number of documents that we submitted to the CQC as part of the self-assessment, there were way over, I think, 200 separate documents, strategies, policies. It's not possible to maintain currency on that breadth of strategy. So I think that the learning in terms of prioritisation for improvement is we can't put a line in a report until we know how we're going to deliver it. We can't put a line in a report unless somebody is accountable for it. We can't put a line in a report if we haven't identified the resources necessary to make the thing happen. And we can't put a line in a report if we haven't thought about what evidence we want to see in terms of whether it's working or not. So that will mean that we will have to reprioritise some of the resources we currently deploy and some of the ways that we currently do things. It doesn't mean that we will be putting a further growth request on top of the already significant request that's going into council through the budget cycle. The reason that the transformation work is so important is that if we get prevention right, that will change people's experiences towards more complex and costly services. And that's the means by which we achieve long-term financial sustainability in a different way of using those resources. So I think what we need to get better at across the board is making sure that planning correlates with action and making sure that we constantly reprioritise what we do based on what the community is telling us, what the data tells us, what the evidence tells us, and what the budget tells us in terms of what's feasible. That's never going to be a standstill position for too long. The nature of the service we offer means we've got to be constantly subject to adapting and reprioritising as we move through. What I want to do with committee, though, is give as clear an account of that as I possibly can do. And I don't think, by the way, that all the improvement we need to achieve is linear. I don't think it's going to be a case of every month there will be stepped improvement. There will be times when we get things wrong. And as long as we learn from them and put plans in place that do work, that's a culture we've got to foster. I think if you want a culture of transparency, people have got to feel confident to be honest. And I will not be pointing the finger of blame anywhere as a consequence of this report. I think this is about using the energy and passion we've got to get it right, to harness and make clear what we do about it. So we've got to get that culture of support right moving forwards. And we've got to try and be a bit clearer in the way that we think and describe things. It's very easy to overcomplicate and to make things too technical. Ultimately, what the report says is that at some level that has translated to the way we support people. And normally when people approach us, there's some level of crisis that's occurred to need the council to get involved. So it's really important we get the right intervention at the right time, and those processes are clear to people, and we do the things we say we're going to do, which on the whole I think we do, but not necessarily in a way that is as straightforward as it could be. And all of that's very easy to say and hard to achieve, by the way, but that is what we've been told we need to do, and I'm clear that we have to be absolutely committed to moving forwards. There is sometimes a concern about change here, and if you've just been told there's more to do to get to the right level, we can't fear change. We've got to embrace it, but we've got to plan properly to get that right.
Thank you. Are there any further questions on the improvement? Councillor Dunn.
Yeah, thank you. Unfortunately, I can't make the briefing. It was too short notice to reschedule. I just want to ask, so much of what we need to do in order to achieve what I know is behind absolutely everybody requires other areas of the city, not only in the council, to deliver those priorities. Do we separate that to a certain degree? And I'm not saying that we should apportion blame, but I feel if we, we've got an ageing population, thankfully we've got a population that survive chronic illness, both physical and mental, and they have a lot to play. And that crosses across everywhere. And I don't think people really understand that sometimes not having something that might feel very important means that that doesn't happen over, that they have that doesn't happen here, and how difficult those choices are. And I don't think we spell that out quite clearly enough. Unless that's happening to you and your family at the time, it seems something that automatically the money will come to. And I think, for all the years that I've been a councillor, the pressures have just increased dramatically every year. And that goes, thankfully, that our loved ones are still with us. But I don't feel that we're still getting that message across. And I think with all these strategies, all these collaborations, I still don't think it's getting across. So I'd like to see that, a little bit about how, I just think it needs to be clearer, just so that we can do what I know we need to do and should do. Thank you.
Yeah, that's helpful. Thank you, Councillor Dunn. So I think I would say three things in response. Firstly, our partners across the city were extremely constructive and positive in the way they engaged with this exercise, and that's reflected in the scoring grid that you can see in the report. Secondly, we've already put the work in to make sure that they fully understand what the report has to say and where there are areas of improvement that cross beyond just the council's boundaries and into a partnership space. And thirdly, based on what you've said, when we describe the improvement plan, I'll make it clear that which is purely within the council's gift and responsibility to deliver, and that we have to do in a partnership way. So committee is clear about how the outcome gets to be delivered and improved, because I think that will probably aid clarity. And you're right, every single statutory partner in this city has a huge impact on the nature of demand that one another face when we are asked to get involved to provide support, and how complex people's needs are as well, so that there is an interdependency and we need to be mindful of that.
Thank you. Can we move on to the last bit of your presentation? Thanks, Matt.
Thank you, Chair. So, at this point in time, these are suggested areas for consideration. I'm very mindful that we'll go through the committee planning process in the normal way to cross the T's, dot the I's and agree exactly what comes when. I'm suggesting for now that progress on the improvement plan initially is obviously a case of presenting the improvement plan itself in the first available committee when it's ready. In the meantime, we use the monthly DAS report as a vehicle to do so. I think we need to determine the frequency by which updates on the improvement plan come through to committee. At minimum, I would suggest quarterly. It may be you wish to see more frequent updates than that. Our performance reporting will, of course, align to the 24-28 council plan. And in terms of those specific areas that I think we need to give individual time to in committee, and I won't break down the detail now, I'll just go with the bullet points. I think assessment and review timescales are clearly important. Safeguarding assurance, voice and experience, including co-production and how that feedback is translated into action. Market sufficiency and commissioning, which is a topic that already routinely comes here. Integrated system development, so it touches on Councillor Dunn's point about those points of crossover like the discharge pathways, community-based support, but also prevention. A continued focus on equalities, diversity and inclusion. I think there are also themes coming out of the transformation work that will add and complement to those headline areas. So that's the initial suggestion. DAS report, table the formal improvement plan, and then have a series of spotlight focuses on those areas that I've just reeled off, and we'll be happy to repeat if members require me to do so. Just finally, before I open that last element out to questions, I would like to thank the committee for the support throughout the process, particularly Councillors Crossthorne, Argentia and McLean, who were thoroughly involved in the inspection process, and the collaborative way that the work of the Directorate was accounted for. I think that's really important going forward as we try to drive improvement. I'd also like to formally acknowledge the hard work of everybody who was involved in the self-assessment, the presentation, the on-site inspection, the factual accuracy work, and the continued relationship with the Inspectorate. Though we didn't get the outcome that we wanted, there is a clear determination to drive the improvement necessary in the future. And more importantly than a CQC good or outstanding, this is about getting care and support right for Sheffielders, and that is what we're all here to do, and that's what we all stand for. Thank you, Chair.
Thanks, Matt. I'll open up to colleagues in terms of the plan that you've outlined in terms of how the committee gets involved and scrutinises progress. I personally would like a focus on mental health as well, because that's one of our areas, and also that's one of those areas where it does, where there is cross work between us and partners. Personally, I think that could be like a sub-highlight under one of the headings that you have mentioned, but I don't know if colleagues agree with me. I'm personally happy with having the DAS report and the quarterly. Yeah, I was going to suggest like a quarterly kind of focus. But it would be good to have a timeline, when I'm assuming that the progress plan will have, because obviously we have to make some steep improvements in some areas to get to, to at least a 7% improvement in our performance in general to get to a good. But I'm happy with the quarterly, unless people want to suggest anything else.
So just to add, I will be expected to report progress to the Care and Health Improvement Advisor on that basis. So I'd really like to be able to have taken that work through committee before we start submitting externally, so it's been scrutinised first.
Councillor McLean.
Thank you. I think I'd be happy with that, and I just wonder whether maybe in the first few months, 6 months or so of the improvement plan, if you think it would be beneficial to come up frequently, as things get going, that might be helpful, just to bear that in mind perhaps. And just to echo all the thanks that have been given, but also that, we only received the report report officially last Wednesday, I think, but already so much work is underway to sort of move forward with the improvement plan. So from a member perspective, that's just really reassuring to hear and see. So thank you for that.
Are there any, Councillor Milton?
Yes, thank you. Just a comment really, and again to echo all the thanks for all the hard work that's gone into everything and the willingness to participate wholeheartedly in the whole exercise. And that, as you said, Matt, not just within our directorate, but with the partners outside as well. And I think, and that was a bad use of the word outside. We're all partners. There's no inside and outside. But I just wanted to just really highlight that I think what I'm most encouraged by is how readily the criticisms are accepted. And that's what the whole exercise is about. Nobody expects to sail through a CQC without criticism. That's what it's for. And, you know, hopefully the inspectors have identified all the right things for us. And I think your willingness and the whole team's willingness to embrace that straight away and not rail against it and not feel down about it, but to just march on and do the best that we can with the advice that we've been given. I think that's really admirable, and I think it's a great credit to the council and to the directorate. Just wanted to say that.
Thank you. It's I think when the senior team had the draft report, we've been in the difficult position of not being able to communicate that to staff who were all desperate to know where we stood. We have to accept that this week and next is about absorbing those messages, and there is some anger and some frustration where people are passionate about what they do and wanted this to be the opportunity for that work to be acknowledged. We've got a series of Q&A sessions that are going on with staff, the most recent of which will be at 4 o'clock this afternoon. We'll keep working that through, and then, as I said earlier, I think it's super important that we convert that energy into the so what then. And in my head already, in 2 years' time when they're here, that presentation is going to be nothing to do with what we tabled before and everything to do with what we will have done in the 104 weeks that have passed. A really clear narrative of effort against all those improvement points, triangulated with evidence about impact in the community. And I don't want any nervousness going into that process. I want all of us feeling we've done everything in our power to drive the change that is necessary, confident. And that will be different to where we were before the inspectorate came in this time round. We know how the process works. The inspectorate will have had a number of additional years under its belt in terms of going around the country, which will help in terms of consistency of approach. But we need to give this everything we've got, and we're determined to do that.
Thank you. I'm going to bring that to a close, and I'm going to refer to the second page of the extra pack, the supplementary pack, which has agenda item 10, where the recommendations are. There are 3. So we are asked to note the CQC assessment report and outcome, to note the areas identified for improvement and key strengths, and note the headline improvement priorities and sets expectations for future accountability and progress reporting at committee. Are members happy to agree those recommendations? Thank you. And we are moving on to item 11. We still have 4 items on the agenda, so I'm going to be very strict with time. Can we all kind of be conscious of that, because people have other meetings and things, and I don't want to have to extend the meeting if possible. So we have item 11, which is the DAS report. So Matt, it's you again.
Thank you, and out of respect to colleagues that are presenting after me, this will be gloriously brief as per your steer, Chair. So rather than go through the full report, I'm just going to pick out the highlights. We talked about carers earlier. Page 100 of the document gave us some really encouraging news that sadly landed just after the inspection took place, but nonetheless is positive. So 4 out of 5 domains in our carers survey, including overall satisfaction with the care and support offer, have improved based on the sample of carers. I think we had 514 responses, so that tells us that we're moving in the right direction with more to do. Committee will be aware Disability History Month ran from the 20th of November until the 20th of December. and there was a really positive event on the 10th of December at the Town Hall to reflect on progress that's been made and the work of the disability rights movement. On to page 101, again, overall positive trajectory on the annual I Statement survey. That's the views of people receiving care and support. But interestingly, the main area of disagreement in the survey was whether or not services were connected, whether or not communication was sufficiently clear, and some of that feedback mirrors what I've just described in terms of the inspection report, so clearly work to be done in that space. Moving on to page 103 and the Horizon scan, just to make committee aware that CQC have recently consulted on the future of the inspection framework. There's some feedback in the report about the areas of improvement they've identified for themselves at a national level. I'm envisaging at the ADAS Spring Seminar late April, we will hear more about how the updated inspection framework will work in practice. The early indications are it will be an annual statement update on the self-assessment that goes through to CQC. And as I said earlier, for councils that are stronger RI, good or outstanding, the possibility of a biannual inspection on site. But we wait to see all of that to be confirmed, and I'll report back when we've heard news at the Spring Seminar in April. On to the data, the positives, more improvement on assessment and support weights, mirroring the context I set for the CQC, decreased numbers of care home admissions, and positive progress on staff training, where we've moved up to 71% of staff thus far in the financial year achieving their training outcomes. In terms of decreasing performance, safeguarding, screening levels have decreased to 78% within 1 working day, and the number of DOLs awaiting allocation are not where they need to be. As per the DOLs item in committee, we're now seeing the impact of annual renewals coming through, adding to the wait list, so more work to do there. Number of people waiting for an occupational therapy assessment, a further decrease, but overall beyond the tolerance that we set, though, as I always say to committee, compared to where we were this time 2 years ago, a completely different performance in relation to OT, and our OT services are to be congratulated, as is the responsible AD who's sitting quietly. This is the longest Kelly has been quietest for in the entirety of her career, over in the back corner of the committee room there. Reviews, overall performance remains fairly static, but I do want to draw attention to a positive movement in mental health services where we have seen quite a significant leap in the number of completed annual reviews for the first time in a long time, so congratulations to colleagues there. Home care waits, a slight increase as well, but again, compared to where we were pre-tendering exercise, very nominal waiting times that many authorities would be envious of. And we are still in a position on hospital discharge where there are ongoing issues with the clarity of the data, so getting meaningful data on discharges has proven a challenge, but the teams have worked incredibly effectively through the Christmas and the New Year period and kept the show on the road in terms of flow. That, I think, is all I want to say in relation to the report, Chair, but happy to take any questions.
Councillor Crossan.
Thank you, Chair. I just wanted to ask a quick question about reviews. Certainly, the improvement in mental health reviews is something to be thanked and applauded, and we're absolutely right to have a focus on that because that's something that people have been really struggling with, and we've had a pretty low baseline on that. So it's great to see that progress. So that is welcome massively. Can we get some assurances, though, that the progress here isn't going to be at the expense of progress in other areas? Obviously, there's been a slight decrease in other areas. Can we get that assurance that we'll see a consistent set of improvements across the board in reviews?
Okay, I think the assurance you're asking for there is quite complicated. So the mental health service is dedicated staff ring-fenced for mental health. There's no map over into other service areas. So any trajectory there will not be impacted by progress in other areas. I think the challenge about we need a consistent step forward across the board is a fair one, and we need in that improvement plan to describe how we're going to make that happen, knowing that we don't have a budget to go out and recruit an additional army of assessors. So those plans are going to need to look at things like magic notes, look at the systems that we operate, look at how we can increase prevention to decrease the number of people in need overall of assessment and review. But there is more work to be done in that space to provide assurance, and the improvement plan will start to answer some of those questions.
Can I ask a question regarding the discharge? I was under the impression that although the numbers have slightly increased, people were waiting for less time, so people were ready to discharge. That's at least what I understand from the data coming from the Better Care Fund and the discharge element of that. So I don't know whether I've got that information before you. I could do as the...
Yeah, so as it stands, we have good capacity on pathway 1, good flow. We're also in the position where our reablement service STIT have got capacity that's not being utilised for discharge, and we've got ongoing discussions to make sure that that capacity is being used more effectively than it currently is. We have high numbers of people going through P3, and we're seeing a corresponding increase in costs of those beds. So at this point in time, our major challenge on discharge across the city is probably more mental health than I would say it is. And I don't mean to sound complacent at all, because I know the hospitals have been under a lot of pressure. But in terms of the data I've seen and the assurance that I'm provided, I think we're doing the job that we said we would do in the Better Care Fund.
Councillor Miss.
Thank you very much. I will try and be really quick. The I statement survey, just a quick question whether the 12% response rate, whether you think that's good. It doesn't sound like a very good number, but in context, if you put context on that to help us understand if that is good or not. And just about S2A, so the somewhere to assess beds. So my understanding is we have a target that we're trying to reduce to way below the national guidelines or national average, which I think is like 6 weeks, and we're on a pathway to get that down to just like a week or something. When this comes down to individual people, that can possibly create pressure. I just wondered what your take on that is. So, for example, a resident in my ward who's gone through that pathway and was safely placed in an S2A bed, so everything working clockwork like it should with the hospital discharge, but then they're feeling very pressurised to get home and not feeling at all comfortable about going home and not feeling safe. So how do we balance our target to reduce the number of days in those beds against the person's perception of their own need?
Thank you. Could you remind me of the first part of the question, please? Could you remind me of the first part of your question? The latter part was S2A. What was the first part?
With the 12% response rate on the I
Oh,
statement.
yes, of course. Yeah, thank you. Yes, so that question is reminiscent of the Mrs. Merton line, what first attracted you to the millionaire Paul Daniels, isn't it? We would, of course, want higher than a 12% rate. We do achieve higher than 12% on the carers survey and the annual statistical returns. I think the team put a lot of effort into trying to get the numbers up as high as they could do. This is a discretionary response, not a mandatory one. It came on top of a lot of previous surveys, and I think there's a bit of survey fatigue out there in the community that probably influenced the low outturn. But I'm not going to take away from the fact that the sample that we did get back did show encouraging trends that we need to build on. So we'll have a reflect on what we can do to drive 12% up, perhaps without mentioning Paul Daniels again in response. Kelly, is there anything that you want to add on S2A? If you come
So I would just add that it's part of the adult transformation work that we're focusing on, and in particular looking at that capacity into Pathway 1. So we've just built into a service level agreement with the ICB our ambitions around how we in-reach where people do have to be discharged into a bedded setting. So really focus on the opportunities around rehab and reablement and recovery as part of that process, but really looking at reducing the number of people that go into a bedded setting in the first place, and where they do so, how do we start discharge planning from day one of arrival, and really work with people in a more proactive way, enabling them through things like occupational therapy, use of technology, and reablement provision.
Thank you. I'm going to bring this to a close. The recommendations are on page 98 of the pack, and there are 4 recommendations. We are asked to note the progress in delivering upon the adult care strategy, Living the Life You Want to Live, note the performance update and areas of prioritization and focus, including performance dashboard at Appendix A, note the strategy delivery update and achievement for this period, and note the progress of our preparation for CUC following the site visit in September and the next step, and in brackets, separate committee report. Are members happy to agree to those recommendations? Brilliant. Thank you very much. We're moving on to item 12, which is the sexual and reproductive health strategy and procurement plan. And I have Sam and some guests that are going to introduce themselves.
Thank you, Chair. Good morning, committee. I'm Sam Martin, Assistant Director of Commissioning and Partnerships in the Integrated Commissioning and Public Health Service here in the Council.
Yeah, Anna Stubbs, Strategic Commissioning Manager for Sexual Health in Sam's team.
I'm Becky Pullin, the Charity Manager at Say It, formerly Sheena Amos Youth Trust.
Hi, I'm Nicola Fernley-Hill, I'm the CEO at Say It.
Shall I do a brief introduction, Chair? Okay, so good sexual health and reproductive health is an essential aspect of people's overall well-being, affects people throughout their lives from adolescence through to older age. And under our public health duties as a council, we lead the commissioning and development of a whole range of services that support good sexual and reproductive health. They range from education, awareness raising, health promotion activities in schools with young people and with adults too, all through to the provision of good contraceptive choices, screening and clinical treatments for sexually transmitted infections. So a whole range of stuff, and we work really closely with colleagues in the NHS, in organisations like the UK Health Protection Agency where we need to, in schools, children's services and our voluntary and community sector, as our colleagues are here today to represent. So we're presenting to the committee today for approval a new strategy which would steer the work on sexual and reproductive health in the coming years in Sheffield. So we're seeking approval of that strategy from a council perspective and approval of the development of a commissioning plan which will relet our current sexual and reproductive health contracts which are due to expire in 2017. I'm in the past, 2027. So the proposed new strategy document is attached to all the papers. I'm not proposing that we go through that today in detail or read it out for you, but it has been developed in consultation with a wide range of partner organisations, and it included talking to some patients in the services and with children and young people over the summer and autumn of last year. And we've taken input from colleagues in children's and education services and clinicians. And we've ran an all-member workshop as well in the autumn of last year, recognising that it's a wide cross-cutting agenda, not just relevant for this committee, but for others too. So the strategy, very briefly, has 4 sort of key aims to improve reproductive health and access to services, to prevent sexually transmitted infections and HIV infections, to provide really good relationship and sex education across all ages, and to develop inclusive, choice-based services. So if we approve that today, the delivery of an action plan will be led by the council, but obviously be overseen and supported by our local sexual and reproductive health strategy board, which includes representatives from across a whole range of health, education and the care system. So that's the background. I'm just wondering, Chair, if because we've got our colleagues here from the Sheena Amos Youth Trust, or Say It, whether it'd be good to just give them an opportunity to talk about their role in the service structures that we've got at the moment, if that's okay.
Please, thank you.
So I'll just say a little bit about Say It for those that don't know us. We're an LGBTQ plus youth charity, working in Sheffield for over 25 years, working with all LGBTQ plus young people and young people living and affected by HIV. We do youth groups, training sessions, we have one-to-one sessions, counselling. We've always been youth-led. Our practice is always working co-productively with young people. And we always deliver trauma-informed practice, and we look specifically of a range of things with our young people, but when it comes to sexual health, we look at healthy relationships, consent, confidence, boundaries, and access to services and education as well.
Okay, do we have any questions? Councillor Dunn.
Thank you, welcome, lovely to see you. I'm really nice to see you because I did loads of work with you last year. Really pleased by this, really happy with the joint working on it. What I'm really keen to know, especially with young people's sexual health, going into the city centre wasn't the way to actually do that, is what would you do if you had an unlimited budget? It's because I think we need to hear, how can we communicate better with our hard-to-reach groups? Because, as you're probably aware, I represent Southey, and it isn't as easy sometimes to be gay in certain areas of the city, and so that I'm really passionate about making sure that access to education, to safe sex, and to actually just be able to talk and understand and not feel stigmatised is so important. So what can we do to make that easier, and for everybody, for the family, for the school, for the young person?
So yeah, nice to see you, Jane. We've done a lot of work together. I think first things first, what's really important is we really value the relationship that we've got with sexual health services for our young people. I think if we look at an unlimited budget, which would be amazing, so if you know something I don't, Jane, then please come and see me afterwards. But yeah, I think the biggest thing for us is about accessibility. And it's about training for staff. I think first things first, it's about getting a really confident workforce in terms of how we work with our group of young people. And I can only speak about, from an LGBT plus perspective. Also, I think it's about having dedicated services. So if we could have, a sexual health worker in Say It, that'd be fantastic. That kind of looks at not just the sexual health needs, but actually it's an umbrella really of kind of mental health and choice and self-esteem and, confidence and assertiveness, all them things that come in that package. And I think it's about recognising that it's not just information sharing, it's looking at the whole young person and about what their relationships have or what kind of relationships they want in terms of a healthy and positive way. Do you want to add anything, Becky?
No, I think you've...
Here we are.
Come back. That's absolutely great, because I think so often people think it is just about money or a building, when so much of it is about education. And I think that's so comforting to know, and that's what you can guarantee. I will be doing everything I can to push that forward, so thank you.
You can ask Sam how many times I've mentioned the word education in our briefings on this particular report. Councillor Crosthorne.
Thank you, Chair. It's always a pleasure to see Say It. As a young bisexual teenager, I accessed Fruitball, as it was then, and friends that I made there are still my friends today. So thank you, as ever, for the work that you do. I think something that I think is really prevalent at the moment that I'm seeing online and certainly targeted at young women is advertisements for against hormonal contraceptives and more natural contraceptive methods, and a lot of misinformation out there in that space. We're seeing, I suppose, a national trend of young women in particular not taking up contraceptive methods. Certainly a lot of the hormonal side effects and issues there have put people off doing so. What work have we got around that? A lot of it comes with education, as Councillor Argentina has said, but is that something that we're kind of aware of and actively speaking up about?
Yeah, it is something that we're aware of that's been fed through our providers and is really worrying, and as a result of that we've got increasing results of termination of pregnancy, and the figures around teenage pregnancy are slowly starting to rise again, so all this is linked. In terms of what we're going to do about it, and this also touched on Councillor Dunn's point, for those of you that aren't aware, there is a new national curriculum that will be rolled out of September for all schools, and it's a massive improvement in terms of the sex and relationship education that will exist within schools from September onwards, and we are looking to support schools in the training of the teachers and the delivery of that. So that's the first thing. And then I've got to be careful, obviously, what I can say about future procurement, but the issues that you've just raised there, we are taking into consideration with decisions that we might make around what we want to do about young people's outreach, for example. But that's probably all I can say at this point. All right.
Councillor McLean.
Thank you. Just a question about SAYA and how you work and some of your thoughts that you might have. It's really great that we've got your charity that sort of serves the need of the LGBT plus young people. But are there sort of communities or groups of young people in the city that you don't see coming through the door, that harder to access? The people, so there's young people out there in the city who might need your services but not know about them or be able to access them, and so I wondered what your thoughts were about that. And then also, what happens when those young people become sort of like adults? You know, are there services that they can then go on to if they need support? How do you sort of support them in that transition once they sort of grow up? Thank you.
Okay, so first part of your question, the communities that we can't reach, you know, it's a question all the time in our charity. How can we reach the people who don't come in? And I think intersectionality plays a massive part in that. You know, it's no secret in our service that we do tend to have more young people who come from the more affluent side of Sheffield and not from the other side as much. So we do focus our outreach in sort of schools, colleges and youth services on, you know, in those areas, so we can help link up with what's already there to try and get just a presence, really, because, you know, they might come from communities that can't talk about being queer, you know. So at least if they know if we're there, then they can come and access us. So that's something that we try and, you know, we are always striving to do to reach those populations. And apologies, I've forgotten the second half of your question. Have you got that? Go on.
I think, if, in all honesty, this is a real challenge for us because there's a real lack of services post 25. And what we have to do is just make sure that we've tried to empower that young person to have the skills and confidence kind of when they're going out into the wider world to kind of deal with whatever they may face. And that's a real problem, because somebody might come to us at 22 or even 23, 24, and they've not had that time to really make them friendships and kind of really feel comfortable being their authentic self. So it's there is pockets of things happening, but they tend to be more specialised. So it might be around mental health, or it might be around disabilities. It's not necessarily just a social space per se. And I think that's there's also away from bars and alcohol. So a really kind of sober, just, safe, inclusive space. And I don't know what the answer is to that. Well, I do, it's funding. But that's not something that obviously we are able to do, and it's really difficult because we have kind of let somebody stay a couple of months, but actually it's outside of our remit, but we've kind of had to look at safeguarding around that. So, yeah, I hope that answers your question.
Yeah, it does. I was just interested to hear. And yeah, thank you so much for coming today and for everything you're doing. It's really important. And like we said earlier when Faith came to talk to us about ISF, it's just really good to hear people come and tell us what's going on the ground, you know, when we're sitting here making these decisions and talking about things. So thank you so much.
Thank you. Yeah, I just wanted to explain why, because we talked quite a lot about young people, and this is adult health and social care. So this is a cross-cutting report that covers everybody in the city. So it's a strategy for the city. And the reason why it's come here is because it's been delegated from SNR. It was felt that it was more appropriate to go one of the main committees, and this fit better than other committees. Thank you very much for the presentation. For me, it's also, I just wanted to mention, because we've talked about the LGBT plus community, but for me, you know, as a woman, also very important, you know, that kind of education around, you know, toxic masculinity and how we empower our girls and our boys to be confident in what it means to be, you know, to be in a relationship, in a healthy relationship from, you know, from all points of view. So, and, you know, we've had conversations on this specifically. So I'm really, really pleased with the strategy, and we'll see how we get on to the procurement and, you know, look at those issues. Councillor Dunn, last question.
Yeah, I should have mentioned it, but I was so caught up in that. I did read somewhere that there was a rise in sexually transmitted diseases in the elderly, especially in elder people's homes. And I wondered if we were also going to educate into that area as well, because I think it's really great that, as I'm classed as an older person, that you are allowed to apparently have a life, but we should make sure that they're having a healthy. So I think as well, I think that education should go through there, and I don't think I'm wrong with that, am I, that there has been a rise?
Yeah, there's been a rise in STIs across all ages, and recently we've been lucky enough to develop a working relationship with one of the professors from Sheffield University who's doing research around sexual health and older adults and taking some learning from that. We are trying to make connections with organisations that represent older people, because I suppose those connections have probably not been as strong as they could have been in the past. So we are really trying to, with this strategy, take a life course approach and not just focus on young people. We do want to work with everybody across all age groups.
Thank you. Thank you. I'm going to go to the recommendations, which are on page 131 of the pack. Thank you so much for coming. And as Laura said, it's always brilliant to have people to actually give us a testimonial, lived experience, or from organisations that actually work on the ground. So thank you very much for coming in. So the recommendations, there are two. They're very long, but I'll read them. So we are asked to note and approve and support the sexual health and reproductive health strategy, including the commissioning of development of services in line with the strategy. Delegate authority to the Director of Integrated Commissioning in consultation with Finance, Procurement and Legal to take all necessarily operational decisions to implement the strategy, and note that these will include determining the procurement approach, approving procurement documentation, undertaking procurement processes, and awarding and entering into contracts for sexual and reproductive health services in accordance with Procurement Act 2023, the Provider Selection Regime and or Public Contract Regulation 2015. Thank you very much, Sam, for that. Yeah, no, fair enough. I know that we have to, cross all the T's and dot all the I's, but cheers. Are members happy to approve those? Page 131, Councillor. Are people happy to approve those? Brilliant. Thank you very much, and thank you for coming again. And we move on swiftly on to item 13. Oh, thank you. I know. Isn't it brilliant? So we have Liam and Charles presenting this item.
Good morning, Chair. Good morning all. Liam Duggan, Assistant Director, Care Governance, Financial Inclusion in Adults.
Charles Crowe, Service Manager for Social Care Account Service.
So, the Council's Fairer Contributions Policy sets out the Council's charging arrangements for people in receipt of care outside of care homes. And this report proposes two changes to our Fairer Contributions Policy, which will affect people who have financial capital, like savings over £23,000, 250, and so are required to pay for the full cost of care. Following a 4-week consultation period undertaken with the people affected by these proposals last year, we are proposing, firstly, the removal of the maximum charge. The maximum charge for non-residential care is currently set at £590 per week, and it's proposed that this cap and the Council's subsidy that results from that is removed from April. This will address a fairness issue whereby people with high levels of capital who access residential care or who access home support directly pay for the full cost of their care, but where those people with high levels of capital accessing home support through the council do not. It will bring Sheffield City Council into line with other local authorities, the vast majority of which, in an increasing number, no longer have a cap. And it will also remove the cost to the council of providing that subsidy for those people with high levels of personal capital. The second proposal is to introduce a £500 a year arrangement fee, also for self-funders, people with more than £23,250, for the contracts, commissioning and financial work undertaken by the council on behalf of those full fee payers in relation to non-residential care. People with more than £23,250 have choices about the care that they purchase and where they purchase it from. Purchasing council commissioned services can represent value for money for those people, but there's a cost to the council of commissioning those services, and it's proposed that a share of this cost is passed to the people who benefit from it. In addition to these two proposals, there are also a range of updates to the wording of the Fairer Contributions Policy, which was last updated nearly 5 years ago, and that's to bring the terminology more up to date, to improve clarity, and to bring in better examples to illustrate the policy more clearly. It also includes changes that are necessary following the committee's decision in December to approve a new charging policy for technology-enabled care.
Are there any questions? I thought Charles was going to say something. That's why I paused there. Sorry. Are there any questions regarding... We had quite a few briefings on this, and we've gone back and forth, So are there any questions? Councillor Alston.
Thank you. Yes, I'm afraid I haven't been privy to the briefings as I'm here as a substitute, so apologies if I'm overlapping. It's as much a comment really as a question. I know that people were contacted, residents who this may be affected, and I did have some casework from some quite distressed people who felt they were going to be affected. And, you know, having liaised with officers, obviously I replied where we were at in this process. But I think what concerns me most is maybe explaining the situation to people so they understand exactly what they're paying and why they're paying it, and also how often that assessment is repeated. Because if people have got a lot of other expenses and they're, you know, maybe, you know, only just over that cash margin, how quickly, how easily they can change the process. And I also wondered how much information people are given about other options, i.e. the option of not going through the council, which of course if people are funding is more than reasonable to do. So it mainly edges around communication, I think, and explaining to people what their options are. Thank you.
I appreciate your feedback there. I spoke to a number of those people as well as part of the consultation, and communication was a key theme. One of the attached appendices is a draft letter that we're intending to send out to the impacted people to inform them of any decision that's made. And there's a specific section in that letter to outline the alternative options and to signpost them to the council's information on how to arrange your own care. So I'm going backwards there. Reassessments, we encourage people to come forward when their capital drops and they are approaching £23,250. The assessment takes a variable amount of time depending on the complexity of the individual's financial circumstances. We would encourage people to come to us when they are 2 or 3 months away from reaching that point, but we would backdate and refund any money that they'd paid if it's later identified that their capital had dropped sooner. It's very difficult because, as you've said, people's expenditures vary. So we couldn't give a sort of a cash point at which to come back to us. Their income varies, their capital varies. We encourage people at least once a year to check whether their capital's dropped below the capital threshold and to come back to us when it does. It's a balance between prying into people's financial circumstances when it's not our, we don't need to know, and reminding people that they should come forward. And we try and strike that balance, and annually feels reasonable. We make a point when we tell someone that their capital is over the capital threshold to come back to us when it gets close to dropping below. We put that in writing. We do our best to encourage that. But that's the fundamental approach there. And the information offer is always critical. We write out to people annually. We try and update them when anything changes. They will get a letter with any decisions made here, specifically targeting points that people raised in their responses to the consultation.
Thank you. Can I move us to the recommendations, if there are any more questions? They are on page 183. There are 4 recommendations. We are asked to approve the removal of the maximum charge for non-residential care services from the 6th of April 2026, to approve the introduction of a £500 a year arrangement fee to full fee payers for work involved in arranging, monitoring and administering non-residential care from the 6th of April. This fee would then be uplifted in line with inflation each year. Approve wording changes to fair contribution policy to reflect these changes and other updates to benefits changes and clarifications. And finally, delegate to officers authority to agree a phase implementation plan for the individual impacted by proposal based solely on income, with the intention of a 3-year phase implementation plan to mitigate the impact in this case. Are members happy to approve those recommendations? Yep. Brilliant. Thank you so much, and thank you so much for the patience that you've had in, drafting the report with us. Thank you. And we are on to the last item on the agenda, and Kelly can finally speak. So it's item 14 is the technology-enabled care service delivery model procurement. Thank you, Kelly.
Thank you. So first of all, full declaration, just a huge thank you to Paul Higginbottom and the team who have pulled the report together and are working incredibly hard in the background. Unfortunately, Paul couldn't attend committee today, so the purpose of the update is really just to give members assurance around the implementation of the technology-enabled care service delivery model, which was actually approved in March 2025. So Thank you. So to date, there have been some key areas of development, and that includes we've just launched our market engagement opportunities with providers who are keen to look at the potential around becoming a strategic business partner. We've also started our conversations internally and as part of our adults transformation work to consider the redesign and development of our current citywide care alarms provision. And we're also moving towards the procurement as part of our development and redesign of our new alarm receiving centre. So the new model, as you are aware, does support our Sheffield vision, and it also supports the best possible outcomes for people. It's about creating a sustainable approach, really embracing the use of new technology that we have available to us. And it's really central to the key plans that we've got in place with regards to Future Sheffield and our adults transformation programme. So just a quick reminder of the current service overview. So at the moment we're supporting 8,000 people with our existing telecare provision. On average we receive about 200 referrals a month and we install around 154 new units. We do take on board around 25,000 alerts per month, and we're working with our existing provider, really looking at that and understanding that. So we're starting to look more proactively where people do access our service about, you know, are these developing social care needs? Is there something we could do from an early intervention prevention point of view? And also working with health and partners, really looking at early intervention and prevention and recognising deteriorating patients. So we're working at the moment collaboratively with Yorkshire Ambulance Service around falls management, and recently have developed a pathway into our care homes in the city. We've got a number of key initiatives that are already starting to demonstrate the power of tech and how this can improve for care and support and outcomes for people locally. This has been really encouraging over the last few weeks because both people across the city who are using services and our providers have been really engaged with us in some of the conversations about our intention and ambitions in this space to move things forward. So I've already touched upon the redesign of citywide care alarms. Some of the work that we've happened since the last time we provided an update to committee is we've actually now launched a tech referral form that's in Liquid Logic that will provide us with the data and insights that we need around the uptake of the technology. And we've also moved towards a full digitalisation of a system in service. So that will be rolled out in April 2026. And again, that's really around efficiencies in delivery of the service and deployment of our staff. As part of the redesign, we are really keen to link with existing customers as well to understand their experience. And that's all really aligned to the conversation that happened earlier around co-production and understanding people's experience of using the existing services. So with regards to the tech service delivery model, we've recently worked with partners to really update the business case, ensuring that it's robust and that our current financial modelling has provided assurance to the director and to people across the local authority. So the aim of the service delivery model is around us keeping up with a really fast-paced tech market. So the amount of different equipment that's coming out, we really want to make sure that we are sighted on that and we've got the expertise within our gift to understand what's going to deliver the most improved outcomes for people and for us as a local authority. So our ongoing ambition is really about putting tech at the heart of everything that we do, and it needs to be one of the first things that we consider. We did used to use the phrase tech-first approach, but actually we've moved away from that now because we recognise that actually it's people first, so we kind of have changed our language in that space. And there's a real focus as well through our first contact and the work that we're doing in transformation around how do we rebrand and expand this service so we recognise that there's more potential not only to bring in existing adult social care customers and double our capacity, providing that about 6,000 people by 2030, but also in the private payer market there's some real business potential there. So the strategic business partner contract would be for 5 years with an opportunity to extend that for a further 2. And the aim of that would be to reduce, prevent and delay further costlier care interventions. The projected savings over the 5-year period are 8.1 million, and that's the net financial benefit. The cost of the strategic business partner is 1.65 million, and that's been validated with some of the work that we've been doing with our partnership with the TSA. We are working really hard in this area to deliver on some of these savings already. So even in advance of the strategic business partner coming into post, we are really embracing some of the technology that's available to us. And we're already seeing that we've got some services that are going to be able to deliver some savings really early on into 26, 27. But whilst we've got procurement timescales in place and a mobilisation plan, we're really ambitious to see whether or not we can pull any of that forward to further sort of expedite the plans that we've developed. So there is a procurement and implementation timeline that's contained within the documents. I won't go into that, but happy to take any questions on that if needed. The market engagement's commenced. We are aiming to offer the contract to somebody following successful procurement in August. And we've set out within the document the kind of responsibilities that the strategic business partner will take up for us on behalf of the local authority. But it really will be that partnership approach, not only with us, but also working with people to understand the difference that the deployment of some of this technology will be able to bring. So the overall document today really is just for noting. I know it was approved in March 2025, but we just wanted to keep you abreast of the developments and make sure that you were cited on the work that is being undertaken to date.
Thanks, Kelly. And as ever, your delivery is always so clear. You can do all the talking you want in my book. Thank you. Are there any questions on this? Councillor Eric.
A comment really, yeah, I really welcome this and the progress that's been made on this. I just have one question though. It's on 2.16, I think, yeah, paragraph 2.16, where we're talking about the focus movement, the move to liquid logic. Now, I know that we have had issues, security issues with liquid logic in the past, I believe, and I'm just wondering whether we're now over that and we are comfortable in that.
Thank you. So from my experience to date, so far, there have been no issues with the ongoing security of liquid logic. I don't know whether or not maybe he was referring to the rotary system that was used in the reablement service where there was a cyber breach a couple of years ago. Yeah. No issues within liquid logic, but just the development of the referral form into liquid logic and the ability for external partners to be able to refer in with an online form. It goes straight into that system. That's really just about providing us with the data so that we can have a dashboard and really understand demand and capacity and the impact of any outcomes related to the provision of tech.
Thank you. Councillor Mills.
I just want to raise this because obviously these things can be discussed in briefings, but because this is the public place, if it's not possible to answer, fine, just wanted to raise it in a public sort of place. So with tech being such a growth industry, the possibilities for profit margins for providers are, in some cases, being kind of advertised in the sector as being very significant. And just wondered what our process is for safeguarding ourselves in where this is quite a hungry market. And, you know, there are big agencies like Tussle who advertise, and I think there's another one I can't remember. There are big agencies who encourage providers into these kind of contracts and tell them how to maximise the profits and so on. And no objections to a company making a reasonable profit. But, you know, when we're talking about things like 60% margins, you know, how do we safeguard ourselves as we go forward? But if it's not a question to be answered today, that's absolutely fine. I just wanted to raise it as part of this, receiving this report.
The assurances that I can give through the procurement process is that we've got really clear KPIs that will be part of that contract. And there will be an expectation that this will absolutely deliver on results. So we'll be keen to, through the data that we're developing, through what's being offered to people, we expect to see, for instance, a reduction in the cost of care packages, a reduction in the cost of sort of, I hate to say bed days, but we know that's how our colleagues in health would refer to that. So it is very much going to be performance driven. but led by outcomes. So we will be looking to secure the best value for money for the local authority. And that is certainly something that, whilst it's a longer contract, we expect it to deliver value for money. It will certainly be something that we'll be very keen to ensure we get the right partner with a good track record and assurances.
Thanks, Kelly. Shall we move to the recommendations? People happy? Page 247, there are 2 recommendations. They're both noting. Note the development to introduce the new tech service delivery model, which will include a 5-year contract in relation to the procurement of a strategic partner and a new alarm receiving centre, ARC. And number 2, note the continuing work being undertaken to complete the service redesign of the city-wide care alarms to ensure that the service is affordable, self-funding, and delivers the best possible outcomes for customers. Are members happy to agree those recommendations? Thank you ever so much. Thanks, Kelly, for coming. That was the last item. And the next Adult Health and Social Care Policy Committee meeting will be held on Wednesday, 25th of March 2026 at 10 a.m. Thank you, everybody, and thanks to all the officers for attending.